Control and Prevention is holding a briefing on the COVID-19 response in Africa. The World Health Organization says Africa's COVID-19 vaccine uptake rose by 15% between January and February. This as several countries embarked on mass vaccination drives to expand coverage and protect populations against the adverse health effects of the virus. Let's take you live to those proceedings.
Itself, I would like to know the status of the regional center in Egypt. Do we have an idea of when it's taking off? And concerning the development regarding Aspen, how do you see this trend? Is it being impacted by the availability of doses that have been donated, that countries have seen these doses for free? Or how is this trend different from the initial plan that the facility had, especially with the South African government, considering this was a South Africa government fully supported initiative? Thank you.
So in terms of testing, Paul, overall, cumulatively, the continent has conducted about 104 million tests. Again, those are official reports. In terms of new tests, just this week, 582,000 new tests were conducted. If you compare that with the last week, that represents a reduction of 9% decrease. Because last week it was that is the week before the continent had conducted 637,000 tests. That again, all of these are reported numbers. The cumulative positivity rate is around 11%. That is of people that are tested, which represents a test per case ratio of 9.2. Okay, which is still high. So I don't know. I don't have the information country by country. But in this briefing, but I'm sure that our Emergency Operations Center folks will have that information. Egypt, the center in Egypt has not yet been operationalized, and because of the still waiting for they call it the hosting agreement to be signed, and I think we remain hopeful that hosting agreement will at some point be signed. Now, the last 2 years have been very problematic for all of us because the focus has been on our ability to respond to this a terrible pandemic. So we hope that this year we can make progress or go back to the drawing board and see what is hindering the takeoff of that and then address it accordingly. So your last point on the donated vaccine, yes, it is really impacting the equation. So again, and your point, Paul, I'd like to expand on that a little bit. Now, if you recall the trend, now memory is very short, and then we tend to begin to not put the situation in the right context. When the COVID vaccines were delivered, the first COVAX vaccines were delivered on the continent around March of last year. The continent was really ready for that. I was at the airport receiving vaccines. People were ready to jumping up and ready to get vaccines. But then there was a shortage of vaccines. Okay, not really shortage. It was completely a stoppage of delivery, if you remember, because shortly after that, India imposed a ban on that. And it became a very big concern for the continent. That's why the continent accelerated the embarked mechanism to acquire its own vaccines. A continent of 1.2 billion people could not have just been waiting for the COVAX mechanism to deliver them vaccines. So that initiative, embarked, which is a historic intervention, strong leadership from President Cyril Ramaphosa and others, Chairperson Moussa Faki, must always be remembered because it came at a point of need. The Afro-Exim Bank allocated $2 billion to supporting that. I like history to always remember that was very important. And if vaccines had been available in a consistent manner at that time, I'm sure that we wouldn't have gotten into the situation we are today. So fast forward, the Africans set up that facility, and the 400 million doses of vaccine was secured and guaranteed by African treasuries. Okay, that we all know. I mean, I'm recalling all what you know, but I'm heading to a point where now that vaccination coverage increased tremendously in developed countries, now they started donating, doing a lot of bilateral donations there. And that, of course, countries started receiving those, and now we're not following through with their own avert supplies. But it's a commitment, it's a legal commitment that they made with, to get those vaccines when they were in need. So you just cannot walk away from those things there. But having said that, it is very clear that this pandemic is not over. So we should not be discussing vaccine needs as if the pandemic is over. We truly don't know how many times we need to booster. I mean, I've received my vaccines and boosted, and I don't know if maybe in the next 6 months or 4 months, I should go in for the 4th dose. The Johnson & Johnson vaccine continues to be one of the best vaccines in terms of protection over time. So it's a strong appeal to all member states to not to continue to respect their engagements that they had through AVAT to get their vaccines. That shows self-determination, and it shows that, I mean, a leadership. It shows ownership of our own health security as a continent. I think we must be very proud of that moment, but follow through and make sure that vaccines that were ordered are delivered, and even take it further and make sure that we convince the population and continue to engage the communities to take up these vaccines.
Thank you very much, John. Let's say hello to Lucia Blanco. And Lucia is with the International Spanish News Agency. Why do you think that Aspen is not getting orders for the J&J vaccines? And who should be ordering those vaccines? Is it governments or international mechanisms like COVAX? And lastly, is the price of those vaccines competitive now? And she says, thanks a lot.
Yeah, I think it's not it's not thinking. It's a discussion that I'm having with the leadership of Aspen, and I'm not the only one they are talking to. They have been very transparent with that they're receiving no orders, and they are very clear that they don't want to surprise anyone. That in the next coming months, if they don't receive any further orders, they will need to shut down that facility. So we cannot and must not allow that to happen. And the orders, as you rightly stated, should come from our international community efforts. We need expression of solidarity and international cooperation, which we've all appealed to during this crisis. We also need that African countries continue to not only wait for donations, but also commit themselves in buying these vaccines, because, again, it's not enough to just get 2 doses. This is a tricky virus. We don't know what the trajectory of this virus holds for us, but making commitments, collective commitments through AVAT, so that that factory can continue to produce the much needed Johnson & Johnson vaccines is critical. I think that, I mean, vaccines, as I said, are not like drugs where you can produce them and put on the shelves. I mean, there must be a collective mechanism. And this brings me to the international community. COVAX, Gavi, the ACT Accelerator must all mobilize and support that company so that they can sustain their production facilities. Otherwise, why have we been all along calling for regional manufacturing? There's a global consensus that in order to ensure global health security, there must be regional manufacturing. Here we are with a company that is producing an amazing vaccine that the continent is using, is a backbone of the vaccination in Africa. Many countries in Africa actually are preferring the Johnson & Johnson vaccine, but is running a risk of shutting down that production. We cannot and must not allow that to happen.
All right, thank you. Judith Akolo comes back with another question. And she says, while you were talking to the PRC today, did you also impress upon them to inform the political leaders in the member states to stop getting excited about the low infection rates and to make statements that, in effect, tend to stop some of the measures that were used to contain the spread of COVID-19? And she says that these kinds of messages are really quite wrong, and they tend to impress upon the people that COVID-19 is behind us.
Judith, one would probably have thought that you were in the briefing today, because the briefing with the ambassadors today, because that was the centrality of the conversation. The centrality was about the pandemic is not over. This is only a low transmission season. Use this period to intensify it. I was very clear that we should use this period to do 4 things: increase vaccine uptake, testing, surveillance, and of course, engaging our communities with the right messaging. Those are the things you do during a low transmission season as much as possible. We also discussed extensively the need to have a common position and voice to protect the vaccine manufacturing industry in Africa, which is just emerging. I mean, otherwise, before you emerge, you die if there's no collectivity around it and support for these countries that are producing vaccines. So I mean, one would probably think that you were in the conversations today. It was a very thorough and thoughtful conversation that I had with all the ambassadors.
Thank you, John. Edith Mutetia, who is with China Daily. What's your take on China's zero COVID-19 strategy? Would you recommend such a strategy for Africa, or should we as a continent learn to live with COVID-19?
I think we should learn to do the things that I've insisted we should do: increase vaccination rates, conduct surveillance as much as possible, increase our testing, and of course, maintain public health measures. That is, of course, washing of hands, masking when you are in a crowded space as much as possible. That's what I think we must be doing on the continent. And public health practice is common across the practice is common. I mean, and those principles are principles that should be valid across the board. I think I've been very clear on this, that the days of massive, at least for Africa, the days of massive lockdown is over. Vaccination rates are vaccines available. We should go out and get vaccinated. And we should also be testing as much as possible, especially decentralizing testing to community testing and self-testing is what I have. I have my test kits here, and each day that I feel like I'm not feeling well, I test myself and whatever. And those rapid antigen test kits are available. That's what I recommend for the continent.
Thank you very much. Agostino Leita is a journalist at Lusa, the Portuguese news agency, and he has quite a number of questions. So he says he'd like to ask you to explain the current situation regarding COVID-19 treatment protocols in Africa. Where do we stand? That's the first one. Then he says, what is being done so that African laboratories can also produce the new drugs under development? That's the second one. He goes on to say, should the pandemic mitigation strategy in Africa focus primarily on treatment at a stage when variants of the disease are becoming less and less lethal? So those are the points from Agostino.
No, absolutely. The treatment, as you know, on the continent is still the access to those drugs, the two important drugs, molnupiravir and Paxlovid, is still very limited on the continent. I think we are working very hard with the two companies, as I told you earlier, that we're working with Pfizer and Merck to finalize the MOUs, the Memorandum of Understanding. Again, it's out of our hands. These things, they are negotiated at the level of the legal offices in both parties, but I've seen progress over the last couple of weeks. Again, it doesn't stop member states to have bilateral discussions. I think some of them are having a bit of the overall access to these drugs on the continent is very limited. We also have heard that one of the companies, I can't recall which one, was going to issue license to several countries to produce the generics. But I don't recall that there was any African country among those countries. But it's something that we continue to advocate. And very importantly, I'll also add to the list of things that I recommended that the way to continue to fight this pandemic going forward is the test and treat, in addition to vaccines and surveillance. So the testing is coupled to treatment. So the continent has to work very hard with partnership with the companies that are producing the drugs to have availability of the drugs. These drugs are so powerful and effective that They really they don't discriminate between variants, so they're effective across the variants. So having a test and treat strategy going forward, just as we've done for HIV/AIDS, will be extremely valuable. So to the extent that if these drugs were available and you have a new variant, the health systems will not be overwhelmed, because these drugs, you can administer them amongst healthcare workers, and it will knock up the virus regardless of the variant very quickly. So I think in some, the treatment protocols I believe WHO is issuing some guidelines. Access to the continent remains very, very limited. We are working on the access issues at the level of the African Union, and of course, in partnership with Pfizer and Merck.
All right, thank you, John. Lawrence Caramel has come back with a second question. Do some countries face lack of finance to roll out their vaccination plans?
Of course, you think yes, but I also believe that there's a collective support that countries can benefit and are benefiting from. You all know that we have the Saving Livelihood initiative, which is a very strong partnership and bold partnership with the MasterCard Foundation. Countries are accessing that. I mean, the UNICEF and COVAX have some support. The World Bank is also supporting, and member states are putting their own resources towards vaccination. Is it enough? Can never be enough, because I outlined the challenges that are required: the transportation, the logistics, the vaccination, the storage, are all key areas that countries will need to continue to need support.
All right. Let's take a second question from Paul Adepoju.
Yes, thank you very much. Dr. John, on the wider lesson that the COVID pandemic has brought attention to, and something that you've continued to reiterate, which is this new public health order. From your personal perspective, talking to these ambassadors and by extension, leaderships from across the continent, are you seeing this active commitment, even when the attention they gave COVID at the initial stage is no longer there, to still be tending towards prioritization of prevention measures over response? And looking at the long term, are you concerned that the gains of prioritizing prevention over control measures is secure or is further threatened? Then a follow-up question to the Aspen development. We also see there are potentials of similar development happening to other potential COVID vaccine production facilities being set up in different parts of the continent. Would you recommend these facilities pivoting to manufacturing other vaccines that the continent has, considering the fact that countries would always be desiring to take free vaccines over something that they want to pay for? What is your position on these facilities pivoting to other vaccine needs that the continent actually needs?
No, I mean, Paul, very good question. I mean, one will also think that you were at the briefing of the ambassadors this morning, because I expanded a lot on the need for a new public health order, which is not a slogan. I mean, the new public health order says there are 4 things that we must do, and do it aggressively and collectively to secure the continent now to achieve its health security sovereignty. And I use the word sovereignty and bold and underline it. And they include the manufacturing of not just vaccines, but diagnostics and therapeutics. I think we have discussed therapeutics already. But let me comment on diagnostics. As we speak, on a continent of 1.3 billion people, Senegal is only now producing the antigen test. Morocco is only now, meaning that during this pandemic, last year, they started producing the PCR test for COVID. And I think South Africa as well. We must remind ourselves that after 40 years of doing HIV testing, there's absolutely no country in Africa or laboratory that produce a simple rapid test for HIV. A simple rapid test for HIV, I repeat. So that is fundamental to the health security of the continent. A continent that conducts about 100 to 150 million HIV tests a year should be able to produce that, and a continent should be able to purchase made in Africa tests. And that way you transfer technology, you are self-sufficient, you guarantee. So that is part of the new public health order. It's not a slogan. Second is the workforce. I explained to the ambassadors this morning that according to the Global Health Security Index, the continent requires 6,000 epidemiologists. We only have 1,800. So here is a gap of about 4,000 that we need to fill. I'd like to see a program that accompanies what President Ramaphosa as a champion announced, I beg your pardon, during the summit, that we need to have an African health workforce task team. And those discussions started already 2 weeks ago. We started the first. So that's a gap that must be met, and that's part of the new public health order. What if we said today that by the end of next year or so, an additional 1,000 epidemiologists must be trained? And Africa CDC has engaged in this. We want to launch the African Epidemic Service Program, what we call the AES, which will be like the early responders to fight these pandemics on the continent. Thirdly, is strengthening the regional and national institutions, like the Nigeria CDC. You look at the tremendous work that Nigeria CDC did during this pandemic, the contribution that Africa CDC has done, and potentially when AMA is developed and finally functional, then if the combination of a network between AMA, there is the African Medicine Agency, the Africa CDC, and national institutions like the Nigeria CDC will give us the backbone as a continent to fight these diseases more effectively. And of course, fourth, and very importantly, is engaged in partnership with the private sector. You look at the work that we have done and achieved during this pandemic with the Afro-Exim Bank, with the African Development Bank, with Strive Masiwa, with Vera Songwe from the UN Economic Commission for Africa. Those are all, different partnerships that we must carry forward there. But also our traditional partners, we must embrace what we are calling an action-oriented, respectful partnership. Partnership that says that we are here to support the priorities of the continent and not to define it for the continent, because the continent knows where they are great to, and they live with these challenges every day. They know exactly what they need, but they probably don't have what they need. So their partnership should align with these priorities. Those are the key elements of a new public health order. It's nothing magical. It's not a slogan for the future. It's something that is happening today. Where are we with that today? Leading to your second question. We launched, to support the first pillar, which is the manufacturing. We launched the Partnership for African Vaccine Manufacturing. That has been a catalyst in moving these countries forward. You recall, Paul, that last year we had a summit where 40,000 people were on that platform. We had a subsequent meeting in Rwanda where President Kagame was there himself and other senior leaders of the continent to evaluate progress. Remarkable progress. I was in Marburg with the President Nana Akufo-Addo, President Macky Sall, and Kagame, with the BioNTech facilities for the container manufacturing facilities that will be shipped soon to Africa. So that pillar is going on. You can hear me talk about diagnostics because we are incentivizing and encouraging all of that. Africa CDC, the second pillar, the head of states have taken a bold decision to make Africa CDC an autonomous health agency of the union, which is the African Union. That is, again, part of strengthening that. And we continue to urge the head of states, the Executive Council, and the Permanent Representative Committee at the AU that they should embrace the need for every country to have their own equivalents of the Nigeria CDCs. As we speak, about 16 countries have a functional national public health institute. We want to see more. We want to see the acceleration of the establishment of AMA. And I think, so those are some elements that are beginning to flesh out as part of the new public health order, which, if done right, will prepare the continent more appropriately to respond to the next crisis than it was before. So I think, again, we're very delighted with that, but we need all these partners. When I meet with all the partners and donors, that is what I say to them. And I ask that we all champion that new order for the continent.
Thank you, John. Agostino later has come back and he says he didn't quite get your answer to his question regarding, he was saying that should the pandemic mitigation strategy in Africa.
All right, Dr. John Nkengasong, that is the director of the Africa CDC, saying that we mustn't be under any illusion that COVID-19 is no longer with us. It still is, but he says that gone are the days when African economies can afford to do any strict lockdowns, that we have to live with the disease, and that indeed there are vaccinations out there that have been accrued from various sources, and people should be taking advantage of taking them. Of course, we'll have more news for you at the top of the hour. We'll see you then.